You're listening to Online Pet Health Podcasts with Dr. Megan Kelly. Continuing education for veterinarian rehabilitation therapists. Learn more at onlinepethealth.com.
Hey Vetrehabbers, thank you so much for joining me on today's episode of the Vet Me Rehabilitation Podcast. I'm your host as always, Dr. Megan Kelly. The Online Pet Health team has been so busy. We are building all the stands and getting ready for our 3-day online veterinary rehabilitation conference. It's called the Vet Rehab Summit. We have a day of hydro, a day of equine, and a day of small animals. This conference is predominantly for our Online Pet Health members. They get free VIP access. So if you're an Online Pet Health member, you don't need to do anything. For the rest of you, if you want to access it, you can register at www.vetrehabsummit.com, and we have opened up a free limited access ticket to the whole vet rehab community, where you can access all the exhibitor stands. We're going to have an awesome 3 days, and I hope to see you all there. If you come to the summit, please pop over to the Online Pet Health stand and come say hi to me. I will be manning the stand for the 3 days. Today I chat to Veronica Devall. She is a vet who's based in Calgary, Alberta, and she has a practice called Holistic Pet Vet Care. She chats to me about how skeptical she was about holistic treatments and how needing treatment for herself, for injuries, she was exposed to acupuncture and how that opened her mind and made her have to make a shift in the way that she thinks about these kind of things, and has been using now holistic and these types of treatments in treating her own patients. I loved her never stop learning attitude. She is the epitome of a vet rehabber, just always wanting to be her better herself and continue learning. It was amazing chatting to her. Over to Veronica. Hey Veronica, welcome. Thank you so much for joining me.
Hey Meg, thanks for asking me.
So it's awesome to have you on the podcast, and I'd love for you to share your journey of how you got into rehabilitation, because I think that it's very similar, you and I.
Well, it's a little bit of a long journey, so let me try to be very brief. But I myself I was in more than one car accident, and I had some body pain, I would say mostly back pain. And that was really where it led me to seeking out, at that point we called it alternative treatment, but now for sure it's not alternative, it's very integrative. But so I sought out a physio actually, who did some needle work on me. Didn't really know the whole point of acupuncture, but it worked instantly. It helped with my pain tremendously. So that's where the journey went. You know, it helped me. I sought out an actual acupuncturist trained in acupuncture, and then I just got interested. And also at the time I was, and I still am, for 20 years now, involved with sled dog sports. So not personally, but on the vet end. And they were using some of this for their dogs, and it was a little bit progressive medicine, I thought. So yeah, I sought it out, and it was a different world for sure, and it's a different part of your brain that you have to use, but there was more and more benefits to it, and it's certainly something I use in my rehab all the time. So that's a very brief story about getting into rehab. It was through the acupuncture world.
Yeah, so as a vet, we're taught to think in such a different way. As you said, you need to use a different part of your brain. I mean, were you quite skeptical of acupuncture initially?
Absolutely. And I would say years before, it was a colleague of mine who's an anesthesiologist, a well-respected anesthesiologist, was using acupuncture or seeking it out. And I remember, going to him and just going, this doesn't work. There's no way does this work. Like, how can this work? It's a bunch of needles. And so, yeah, I was very much Western-minded thinking. And until something happened to me, and it made a difference, because even being so skeptical and it working. So they call it placebo effect, but I wouldn't say I had any placebo. I was no way was it working. So it did work. So yeah, human beings, we do have placebo. Do animals have placebo, or do we create that, right? So it's a whole, it opened my brain, and it made me much more just because we can't, in some ways, Western minds prove it. You know, we talk about our gold standard and our, you know, scientific studies, but I think it not more than just using acupuncture, but it also made me a little bit more open-minded to other treatments that have been around for thousands of years, by the way. So, yeah.
Yeah, I think the thing is, it's just so hard to understand because
Correct.
of the way that we just, to try and understand it is so difficult. So I recall, you know, when I did my acupuncture course in the UK, it was only vets, obviously they were there, and there must have been about 30 of us. And the instructor asked, is there anyone here that doesn't believe in acupuncture? And I was the only one who put my hand up, and I really didn't. So it's amazing that I was actually sitting there, but I knew that I had to find a better way to manage my patient's pain, and giving them anti-inflammatories just wasn't the way that I was going to do it, having seen all the side effects. But I, at that stage, was struggling with really bad sciatica. So that afternoon, we started with putting the points in another vet. So we paired up, and we had to put needles into another vet. And I had the most amazing night's sleep that night. I had no pain. I felt amazing. The next day, I was like, I felt like I was walking on air. I just couldn't believe it. I felt so balanced. I was amazed. And that day, yes, I was converted, and completely changed.
So you just said, you know, you experienced that. I think the best doctors and best veterinarians are, you know, we've been patients before, and we have an idea of what it is. And I think the skeptics also make the best, well, if we're converted, right? Because we see what it can do for us. And being a huge skeptic, as I was, and it sounds like you were too, I think seeing that and just going, okay, we got to understand it. Like, how does this work? And not always will we know, but there's more and more of our Western conventional research going into it that we're finding. And isn't that great? You know, I think we were probably presented with our period of pain to open our minds, right? So that's what hopefully, you know, we get out of that. Like, it's a good thing, right? So.
No, I mean, I think it's exactly that. And the most amazing thing for me is that once that happened, it's then opened my mind to so much more, because I realized, actually, I know nothing. You know, when you qualify as a vet, you think, you know, you've done all the studies, you know everything. This is what happens, you know. And then I started to think, well, what about all these other things that I've been skeptical about? Possibly, you know, there's more to this than I actually know. And that just opened me up to so many different ways of treating my patients, which has been amazing.
Which is great. And I agree with you too. And I think we tend to get into where we, even with our studies, and, you know, and I've took this journey, and I would like to think it's continuing, even though, you know, where I get the diplomat status doesn't mean that I know everything. I'm still learning. And just in fact, I went, weeks ago, I was in Poland for a veterinary acupuncture conference, and one of the speakers said, you know, we have a bias. Doesn't matter. We go in and we look at a patient. We say we're taking all the history and information, but our brain has triggered into a pattern, right? We kind of look and link it up, and no matter what, we still have a bias. And I took that from this veterinarian who's been probably longer than I have been doing acupuncture, but it was good to know, because we have to still look at the individual and take all our information, but be open-minded and know that we don't know everything, and seek out help and collaborate, which is very important. But just look at these different types of medicine that maybe aren't so conventional that we've been taught, you know, in our schooling. So anyway, yeah, I agree. It's to be more open-minded and to know what we don't know and seek out and to help our patients. I think that's really what it's about. That's what, you know, I want to continue to do, is help my patients in any way I can. So especially on the pain aspect. I mean, that's what I do. That's what I took this journey, was to, you know, to help these guys. And I see a lot of senior patients, and it makes me feel good when, after just one treatment, whatever that may be, but usually there's a combination of therapies that I use, they feel better. They have a better sleep. They're, not pacing, or and sure, I still use conventional medication. Absolutely.
Yeah.
Right. It's trying to take, a colleague said to me, don't throw out the baby with the bathwater. So, it's not one or the other, it's both. It's integrating both Eastern, Western, conventional versus unconventional, what we think of it as, as how we were taught. So I like to think I'm, doing that. So hopefully, but I still continue to learn. So
Yeah, I love that. So one of our hashtags that we use is never stop learning. So Vetrehabbers never stop learning. So
yeah, and I
that's
think that's good, right? Because there's always something to learn. Yeah. From our
always.
patients, from our colleagues, from paraprofessionals, from who knows, maybe it's, not like it could be something else too. It's just, something that you see, even a comment, at a convention for something I was learning, just that makes you go, okay, yeah, you're right. Don't get stuck, don't get stuck in the patterns and thinking you have to know everything too, right? So, yeah.
I love that comment about the lecture that you heard in Russia, because we do, because we often see very similar cases over and over again. So we have this idea when we have a cruciate, this is how it's going to present, this is how it is. But we need to look at every individual patient. And we can't sort of have some idea of what we're going to see and how we're going to treat it before we actually look at them.
Right. Well, I think too, and we are still in a very new developing field in rehab. And I think when you've been doing it for a while, 10 plus years, you're looked at as the one that should know everything. So I think it's just human nature to say, oh yeah, I've seen this pattern before and this is what it is, right? But I think it's just very humble. Veterinary medicine is very humbling. I've been taught that when you start feeling that you know everything, guess what? You don't, right? So, so I think it's just that, keeping that in mind. So I thought that was very worth hearing. So passing that along.
Yeah, thanks for sharing it. Let's chat a little bit about your business. So you have a practice and you contract to other clinics, right? Tell us a little bit about how it all works.
Yeah, so it's a little unconventional. I started in a referral practice, and I was still, my own entity, but I built that. That was, well, I guess 12 years ago now. And it became kind of cookie cutter. We had the underwater treadmill, the laser, and we did our patterns, right? We saw a lot of neuro patients, got them back up walking. It was great, but and then the cruciates, it seemed to be the surgeons would just, and that's what we would do, mostly the rehab there. So I went on to a different thing, again, more of seniors with pain management. And part of my, I have different types of patients, but that's a big component, are the elderly, certainly the chronic arthritis, the chronic pain. Then I have my sporting guys, which are, their own entity. But how I do that is I have 2 clinics now where I go in certain days and I just see those patients. So they come in specifically to see me for rehab assessment treatment. And I don't have an underwater treadmill, so I have to be a little bit more imaginative. I can refer, but a lot of these guys are more chronic, and meaning, the water treadmill is a great idea. So we do use that, but not always. And I have very committed owners. That's part of the relationship. They come to see me, they have to do the work, otherwise, it doesn't work, right? And they get hounded for it. So it's like, if we were to go to a PT, we would get home exercises. So I give, just like you, I think, you give, it's important that the caregivers, the owners, the people in their dog's life, mainly, I do have a few cats that I see, but that they have to be involved. They've got an older patient or one that's got chronic pain. We have to change their, what we do, whether we look at their environment, of course, right? So making sure that they can handle things, if there's stairs, whatever, what we might have to do it, right? That they're not a 2-year-old anymore, or they've got this and it'll always come back. So it's managing it, right? It's creating that pain. I hope for pain-free, but even if we can get it to where they are able to do more, so their mobility goes up. So I go to these clinics, we do the assessment, I see repeat guys, pain management, whether it's with conventional medications, the pain meds for my idea is short term, trying to get them off that because of side effects mostly. But some of these guys need it. They need the gabapentin long term, and they need some other medications. And then exercise are a big thing, and core work and weight loss usually. It's about managing these guys to give them good quality of life. So that's mostly what I do. And then I do see the I'm not going to call them crazy, but the very intense, usually agility dogs. I see some working dogs. And they're a whole different thing because it is about the agility is recreational, so we have to make sure that they're good to go. But if we're working dogs, we got to get them back working as soon as possible, right? So these guys are high drive, and when I talk to their owners, it's about, they got to control that. So I just had a dog the other day come in, and this owner was so frustrated, 2-year-old lab, very high drive, and she's like, a growing pull. And we had to go through what she's doing, and she was so depressed that this dog was so fit that she had an injury. And I said, well, even athletes can get injuries. We got to, just bring it in. So it's a lot of counseling, I would say, too, for owners, right? And you've probably dealt with that too, right? But it's similar to what human PTs do, but I think also we get more involved with their whole world, what they're doing, what they're feeding them, what calories, so it's very much a holistic approach, I would say.
Yeah.
Anyway, sorry, I'm running on, but that's what I do. Okay. Yeah.
Yeah. So how does it actually work? Do you have a brick and mortar practice for your own practice, or is it just working at those two clinics and you have a name, which is your entity, and you work at those two clinics?
Yeah, that's basically it. I will do some house calls too, but I don't have anything where the patients come to see me at that Devall Veterinary Consulting Service. I go to a different practice and see them there. So yeah.
Okay.
Yeah.
And so how do you book your appointments? How does that all happen? Does it happen through the clinic?
Relationships, it depends, but most of it's booked. So on my website, they go to the clinics, they do have contact with me. Some of my clients will email me and then I book it. So it's a little bit, I guess, not very strict, but it's what I prefer is the booking through the clinics, calling the clinics and going through. That makes it easier, but sometimes it's, I just book it and make sure that the clinic that time is open. So
yeah.
So the clinic staff will book it for me. Yeah.
Is it challenging having to be at two different places? Are they quite far away, or do you do it on days? How do you divide your week up?
Yeah, there's structured days at the different clinics. And then on my days off, if I'm, need to see animals that are they're not mobile enough to come to, or anxiety or whatever, then I'll go see them if it's just easier for me to go see them. But that's not that common. I try to structure the patients at the clinic. It's much easier for me. I have my equipment there. I don't have to, take things with me. But the odd one, the older patient that needs that, I'll go. So yeah, so it is structured days. I separate my days and half days. I try to do half days. It makes it a little bit more. So one day I'm actually at both clinics, but morning and evening. So yeah.
Okay. And so when you say you leave all your stuff, so do you have your own consult room or do you have to share a room with somebody? So somebody's using that room at other times?
Yeah, so one clinic is, I have my own consult room. It's designated just to me. It's a bigger clinic. So it's quite nice, dim lighting, there's no table. So I have a bed on the floor and no slip flooring. They come in, I have my peanut balls in there if I need them. I have, it's just calmer. I think we have a cat at that one clinic. She always likes coming into the room and hanging out there, right? So it's just got a different vibe in a kind of a crazy clinic. And the other one is I do share the consult rooms with, when I'm not there, that room is used further. So it's a little bit smaller practice, so designated times are important that I kind of have that room during that time, but not for the rest of the time. So yeah.
And how do you work the rooms? I mean, do you pay a rent per month for the rooms, or do you just give them a percentage of your income, or how does that all work?
Yeah, that's how it works, is percentage. So
Okay.
there's been some talk, it just, as far as rent, but it works out better for both parties, percentage. Yeah.
I like that. I've done that before, consulting at other practices where you do that because then, if, for example, you go away for 2 weeks, they're still using that room and then you're not having to pay them any rental for a room that you're not using. And it also just means that you can cover your overheads all the time because if you've got rental and something happens, let's say you break your arm or whatever, then you've got overheads that you can't pay for because you're not working. So I like it too. I think it's a win-win.
Yeah, it's worked well for me for a number of years. So yeah, we're doing okay with that. I think, they have that designated time they can refer if they need to. And so yeah, then they got, when I bring my own patients in. So it seems to have worked well.
And what are the biggest challenges of working this way, working at two different places? I can remember at one stage I had 3 clinics that I did this. And that's actually when I eventually opened up my own clinic. I just thought, I can't do this. I was also treating horses at the time. So I was doing horses and small animals at 3 different clinics, which is maybe a little bit too much. But and then I also wanted that underwater treadmill, so, so I just sort of created a brick and mortar practice and downscaled the horses and eventually ended up just doing the small animal. So sometimes moving around, it's a bit disruptive,
Absolutely.
What are your challenges? I mean, what are the things you like about it and what are the things that you don't like so much?
Well, I think what I like about it is also the most challenging. I like the being at different places. I like it. It keeps me interested to be at different places. But you're right. I have to make sure I know what day of the week it is, or where I'm going. So that is the most challenging. So, it's good and bad, right? And I think when you're right, when I'm sick, I don't get paid. I have to go in, right? I don't have anybody to take over for me. So that is too, right? It would be nice to have a collaboration. But for reasons, I like to travel, I like to spend time in the mountains. I have my own dogs. And so I've kept pretty tight as far as my cases. So it's good and it's bad. It would be nice. Like I say, I want to help my patients, and I think reaching out to more. So whether that be, again, setting up a referral practice, because in my city it's still, amazingly enough, there's a lot of work out there, right? So I think I'm at this stage now too. Do I continue this, or so? It's good, right? But you don't want it too much where you're so distracted. So this is good, but now I'm starting to feel like I need to do more. So
yeah. So I mean, one of the things when you're on your own, so I think when I first started, I was completely on my own, and then started to hire more people. And sometimes it gets a little bit lonely on your own. So, working at other clinics is great because you get to be around all the people in the clinic. And often you also get a lot of referrals from that clinic, So one of the questions I want to ask you is, do you get enough referrals from each of the practices to fill those consultations, or are you having to market and get other referrals from other vets, and are they referring to those practices?
Right. And I still think, I don't know what it's like for you, but it takes a while for veterinarians to change, for the medical world to change. It's been recognized as a specialty. So I think the newer generations coming out and going, okay, yeah, right, there's specialists in this. But I hate to age it, but my age group, and just there's that transition that they go, well, Metacam, NSAIDs, they can take care of everything, right? It'd be nice to see these patients sooner, because we know majority of them are strains. They don't need, the 2 weeks of anti-inflammatories were actually probably creating more problems. So, but it's hard to get across to our colleagues, right? I would say majority of they're not referrals from veterinarians. There are people seeking it out. So I think the wave, and I've been saying this probably for 10 years, but the wave of people going to their veterinarian saying, I want to see a rehab specialist, right? I want to see somebody that does this, as opposed to feeling that they have to go elsewhere on the internet to find. So I'm starting to see more referrals, but it truly is, and I get referrals from surgeons that, cases are post-op or they're non-surgical. And, but unfortunately, it's not from the general practitioner yet. That's not a mainstream yet, right? So
it always makes it challenging for the vet rehab therapist, because you always think like, I can remember, when I first opened my practice, who do I try and target? Do I try and educate the pet owners? Do I focus on educating the vets? And I just did a combination of both of them, basically. I educated the vets and networked with them to try and get referrals, and I also educated the pet owners, and it worked really well for me. But I must say, initially in my practice, it was very similar. So it was mainly from pet owners, and then word of mouth, and then them coming, and then them actually helping to convert the vets. So them talking to their vet saying, this is what I've done, and me sending my vet reports. And then the best way to convert a vet is to treat a vet's dog or cat.
Yeah.
So, I've had some vets that were completely, I used to, in Cape Town, they used to call me the hocus pocus vet. So I think it was smoke and crystals and everything. Right. So the name of my practice was Holistic Vet. So I don't know, for some reason they thought it was, or I don't know what they thought. And I remember this vet, I went actually to go visit, and I stood at the reception and I said, I'd love to chat to him, and she went into the consult room and she came back and she said, he doesn't want to speak to you and he will never use your services. He doesn't believe in anything you do. That's it. And I remember just being so hurt and just thinking, oh, okay. And I thought, I'll just try again. And I tried other people and I tried to reach out to him a few times. And then one day he phoned me and said his dog basically has got some neural problems, and so it's been operated on and nothing has helped. And the surgeon actually said, you need to go to Megan Kelly. And so he came, and reluctantly, and I treated his dog and improved things and got the dog walking again. And that was it. He was converted and referred cases to me every single week after that.
Yeah.
But it is a struggle.
It is a struggle. It's still new-ish, right?
Yeah.
It's not really, but it's new in the world, in the eyes of our veterinary world in Western medicine. It's still new. And so there's more and more surgeons on board. And I think that I'm definitely seeing. And one of my main referrals is a surgeon I've been working with for years. And you're right, converting her. I mean, a chance to cut is a chance to cure. But, she had stuff that went wrong with her surgical cases, and then rehab actually improved them. So they're slow to convert for sure, and it is a bit of an uphill battle. But you're right, those ones you just go, whoo, great, spread the word, right? And it's nice. It's nice to does it make you, I mean, it's nice to validate, right? We know what we can do. We know what rehab can do, but we need other people in our veterinary community to say, yeah, and I think we'll see it, but it's going to be probably, that was 10 years ago when I started this journey or more, and now we're in the next. So hopefully we get, a very big surge that more and more people are looking for it, and with pain management, and we're just seeing it. So yeah, so it is, yeah, it's a struggle for sure. Yeah. And
I think the biggest impact.
Yeah, go ahead.
Carry on. No, you go.
Well, I think it's harder to convert our colleagues for sure. But you're right. If you get those opportunities where they come to you for either their patients that really make a difference to them, or their own dog for sure, right? That you don't have to say anything. But I think now newer generations, they're being taught a little bit more, and I think it's unfortunate that is that period of time, but that's medicine, right? Evolution of medicine. Yeah.
Yeah, I mean, the younger generation are definitely sort of more in tune with what we do. They know what we do. I think they're being lectured, not that much, not enough, but
yeah. And I think that's it too. I think it's worth talking to the new vet students, right? And saying, getting that seed into their, so I agree. That's something that probably we need to do more of that as rehab people. So, yeah.
So I saw a lot of really great impact from when I started lecturing, and I can remember just being so nervous to go there, but I just put myself out there, and I offered myself to lecture, to write articles for magazines, and I started lecturing to vets about rehab. So very basic sort of entry level stuff. And I think my very first lecture I lectured on was about rehabilitation products. So actually just teaching them about products, not necessarily what we do, just all the different products that they're not aware of that are out there, like harnesses and booties and dorsiflex assists and things like that. And, sticky paws and, all the things that, we sort of recommend and potentially sell. And I must say that was a very good lecture, because it really wasn't sort of telling them all about rehab and then just switching off straight away. Products was something that they could understand, and they thought, I could sell this, or my patients could use this. And that was a very good introduction, because I was stocking a lot of those products. So then they would refer their patients to come and buy the products, and we'd have conversations with the clients, and then eventually it would slowly start to instead of them just referring, they'd refer for acupuncture or other things. So the lecturing really helped, and I always encourage the Online Pet Health members, wherever they are in the world, to start lecturing, to lecture the vets, to lecture the people that that need to know and be educated about what we do, because that's really the problem, is that the reason that we're not getting referrals is because they don't have buy-in, because they're not educated in what we can do. Sure, some of them maybe know about what we can do and are just not convinced, but that's maybe our fault. Maybe we need to do more convincing. We need to be better at explaining it and showing our value.
Yeah, you're right. And I think you just said it, buy-in, right? They have to hear it more, see it more. It might trigger something too, right? So you're right. We have to be better at it. You can't just sit here and complain about it.
So let's chat a little bit about the sled dogs, because that's sort of a passion of yours, isn't it?
Yeah. It's crazy passion. But yes, I've been involved in that for over 20 years. So, and it just became it was like an interest. I'm like, oh, I kind of like to see it. I find it fascinating. These dogs are incredible athletes. They love doing it. They can run for, hours, and really there's, history, there's tradition. I mean, they were a working breed, back in the turn of the century, in the gold rush days, in the mail carriers, and now it's just a pure sport. And it can be a really intense sport. And I've sort of taken my skills away from the marathon races, because you can't really do any rehab for them. You're pretty much saying, yeah, this dog can't run. And it's not necessarily, I mean, there's strains, right? That a majority of these guys can't continue their 1,100 miles, which is kind of insane, actually. But, it's the only species that can really do that kind of thing, and they're incredible. They're really incredible to work with. But my main focus in the last number of years has been stage racing, which is very great for a rehab vet, because I'm there to teach these guys what they can do for their dogs to prevent injuries. Harnesses are a big thing, harness fit, but also how they can treat them. A lot of these guys have lasers right at the race that they're allowed to use. Acupuncture, for some reason, you can't use it, but because it's a needle, so they can't have any needles, right? Because they're trying to avoid injections. But stretches, finding the problem is what these guys really need help with. And it's fun. When I started at this one stage race, which is a big one in Wyoming, they modeled it after some of the European races. So stage racing, let me just explain it. It's not a full marathon. These dogs are raced 30 to 50 miles, one stage, so that day. And then another day is another race. So it's a start finish. It's like the Tour de France, yellow bibs, that kind of thing. We actually have a yellow bib. So it's all timed, okay? And it's very dog friendly. There's veterinarians that were checking all the dogs, prior to, right after, and we're getting on top of the injuries, which are 99% of them strains. We do see the occasional broken bone, but that's, like I think with any extreme sport, you're going to see that. So we try to prevent it, and that's trail conditions. But we're looking at trail conditions, and if it's too rough, they don't run. So I like to be a part of it because I love these dogs. I love them to continue what they're doing, but also to make sure they're doing it appropriately, that they're not, because they are high drive, that they're not, and the adrenaline, right? They can run on anything. So that we're smart, that we're protecting these guys, that they continue to do it and love what they're doing, and they don't, have to do it, basically. All right. So I think it's a fun sport. It's still, there's controversy, right? Making these dogs run. And I think, honestly, I want to help all my patients. If I felt that, I was not helping the race, then I probably would just back away. So the stage racing is, again, we get a lot of people that come and see it. It's very exciting to watch these dogs, starting and finishing, and who's running, and we just don't see the severe, like the diarrhea, or, these guys having problems or deaths on this race, like some of the marathoners, right? So that's really what led me into rehab, actually, is that sport. Seeing other veterinarians that were involved in it, and just these guys, what they wanted to do for their dogs to have them healthier and run better, obviously, because they run better, they run faster, and then they win more, right? So that really, when I started with my trail vetting these races, that's what led me into acupuncture, and from there it was a slippery slope, right? It just continued. So yeah.
So have you ever competed?
No, I've been on runners and I've been training dogs, but which is incredibly fun. A racing team that goes very fast, and I've fallen off a sled too.
Yeah.
Got banged around, but no, I've never raced. I think you got to have a whole different. First of all, you got to have a lot of time on your hands and or money. And it sounds exciting, but no way. It's too much hard work. Thank you very much. And you get kind of obsessed with it. I think even veterinarians we're a little funny that way, that keep coming back and doing this. So, because it's all volunteer. So I think we're even more nuts probably than the people that that have the dogs. So some of my good friends have dogs or used to race. And both my dogs are from an ex-racer. She's retired now, but they're Siberian, so they're not the fastest dogs, but they come from a racing line. And I have a little girl that is a retired sled dog, and she ran the Iditarod. So, and she's a tough little thing. So,
sure.
But yeah, she's fun. She's fun when you put skis on her and you go. So, not on her, on me. Skis on me.
So besides volunteering at sled dog races, do you have any other hobbies that you do?
Well, I touched a bit, all in the winter, which unfortunately we had a big snow dump here, like on the weekend. So we have a foot and a half of snow on the ground, and it's like first part of October. That should not happen. But skiing with my dogs, just no competition or anything, and hiking when there's no snow. But yeah.
So cross country skiing that you do?
Yeah.
Yeah. I love cross country skiing. So we don't have any snow here in South Africa.
Okay.
But we've got family in Sweden. And so there's a race called the Vasaloppet. I don't know if you've heard about it.
No.
It's a 90-kilometer cross country ski race in Sweden. So I've done that twice.
Oh, wow.
So yeah, I love it. Absolutely love it.
Great. There's a few.
I would love to live
not with a dog though, just on your own.
No. But I do see those people cross country skiing with their dogs.
Yeah.
They're usually skating because I do the they call it langlap. I don't know what the straight one. And you see people skating and the dogs. Right. And the dogs love it. They absolutely. My husband and I always comment and just say, look at that dog.
It's so much fun. So much fun.
Yeah.
And the Norwegians, there's a lot of skijorers in Norway, with their dogs. In Russia too, it's also, they have these small races. So very fun. I think, the world of sled dog racing, not the big teams anymore. You might see these stages, but the skijoring and then the bike joring tends to be big. I know it's huge in Spain, right? That I have a colleague that she does a lot of these dry land races. So and it's just fun, and you can have one or two dogs and you take them out, right? So that's the fun part. Yeah. So it's good because you're exercising with your dog, and you're doing something you both love, and it's it's a great thing. So just got to keep them, injury free, right? And do the right thing. So yeah.
Awesome, Veronica. It's been so lovely chatting to you.
Yeah.
I feel like I'm looking at the time now. I can't believe how quickly it's gone. And we've jumped from topic to topic. But I love your never stop learning attitude. Thank you just for everything that you've done for us, for lecturing for us, and just being so awesome.
Yeah. Well, thanks, Dr. Meg. You're awesome too. We got to stick together and keep learning, right? And you're doing a great job. I commend you tremendously on you're doing a lot for rehabbers and getting the word out and sharing, what each of us can learn from each other. So I think that's great. So thank you.
Thanks, Veronica.
Okay.
Have an awesome day.
Okay,
Bye.
you too. Bye-bye.
For more information on how to take your career to the next level, go to www.onlinepethealth.com. Please don't forget to subscribe to my podcast so you'll get notified. I'm here every single week talking to vet rehabbers from all over the world, learning, and I would love you to join me. Hope you have an awesome day further. Cheers for now.